gentleman from Kentucky.
Gentleman's recognized for 2 minutes.
Thank you, Mr. Chairman. Madam Speaker, the Democrats' health care law has only been in place for 10 months, yet the problems and negative effects are already painfully clear and well documented. The American people stood against it when it was forced through Congress last year, and they took out their frustrations on this bill at the ballot box in November with a mandate to repeal it. This government takeover of our health care system will not improve access to health care or lower costs for families and small businesses. It's just not in the math if we use the same math that is used by the rest of the country. Since this law was passed, premiums have increased again, putting more families in a difficult position of choosing between keeping their health insurance, paying their heating bills, or putting food on the table. In addition to failing to achieve any key goals of health care reform, this law imposes new taxes, penalties, fees, and paperwork burdens on small businesses that drive our economy. The National Federation of Independent Businesses has found that the employer mandate alone will cost 1.6 million jobs, with about half of those lost by small businesses. Face it, Obamacare massively increases taxes, massively cuts senior benefits, and creates over 100 new agencies, commissions, and boards, and that will massively increase costs. Over 100 new agencies means more federal employees, more tax dollars required, and more complications in access to health care, and brings the IRS into your private health care decisions for the first time without addressing the key drivers of cost. Adding more taxes and regulations on job creators will only serve to prolong the economic problems and high unemployment rates we're experiencing. This is too big of a burden for our economy to wait. We need to start over by repealing this bad law now and beginning the process of producing common sense reforms and fiscally responsible solutions. We can reform health care in a way that improves quality, reduces costs, and increases access, all without burdening our economy or increasing the debt that will be owed by our children and grandchildren. As a member of the Ways and Means Committee, I look forward to following through on our promise to replace the current law with proposals that actually accomplish these goals of reforming Washington, bringing private market reforms, reducing costs, and dealing with defensive medicine through real debate, real hearings, real markups, and bipartisan input. As an original co-sponsor of H.R. 2, I urge all my colleagues to join me in supporting this repeal, and I yield back.
Gentleman yields back. The gentleman from Michigan.